Erectile dysfunction is an inability to be able to get an erection or to be able to maintain erection once you have it adequately for intercourse. Getting erections is actually quite a complex process. There are multiple different levels involved. There is a network that comes from the brain, and it is necessary for the message to get from the brain to the blood vessels to be able to dilate. Then the blood vessels have to be healthy for the blood to be able to come in, to be able to get an erection, and the nerves that communicate between the brain and these blood vessels also need to be intact. There are multiple processes that can affect this process at any one of these levels. The way these three processes is linked is that sexual stimulation, which is from the brain, is the necessary input that gives the process the stimulus for the nerves to come into play, with the message being sent from the brain along the nerves. So it is necessary to have some sexual stimulus. There are multiple causes of erectile dysfunction. There are natural causes of erectile dysfunction. Patients that are diabetic are much more likely to get erectile dysfunction. As patients get older, their erections certainly start to taper, and approximately 50% of men in the age of 50 have some problems maintaining erections. If patients are obese, there is certainly an increased incidence of erectile dysfunction, and excessive alcohol or smoking also can affect their erections. There are multiple tablets that can cause erectile dysfunction, and then one of the most common causes of erectile dysfunction at the moment is secondary to surgery, and most commonly prostate cancer surgery, which causes erectile dysfunction by the damaging of the nerves, which give the message to be able to dilate the vessels for erections. Treatment of erectile dysfunction is quite complex, and the cause of the erectile dysfunction is certainly important in the management. In natural erectile dysfunction, not caused by surgery, there is a stepwise treatment of erectile dysfunction. A large amount of the sexual dysfunction is psychogenic, and therefore it is very important to get positive feedback results. Usually the first line of therapy is medical therapy, which includes all three of the PDE5 inhibitor tablets, which are commonly known as Viagra, Levitra and Cialis. All three of these work in a very similar action, but some patients will respond to one and not the other. These should all be tried as the first line of therapy for erectile dysfunction. Unfortunately, they don't work for everybody, and when they don't work, the next step along the way is to try injection therapy, which is an intracavernosal injection. Some patients have significant problems with this, both physically and psychologically. The thought of having to give themselves a needle every time they want an erection has both a physical problem in that some people are needle phobic, and also there is a major problem with spontaneity in sexual relations if you have to stop, go out to the bathroom, draw up a needle and give yourself an injection to get an erection. If these do not work, there are other things that can be used, such as vacuum pumps, but some patients find these difficult to use. They can cause bruising, and they don't need to be used in isolation. They can be used with the tablets and with the injection. The final step and the best form of treatment for erectile dysfunction, when no other treatments work, is a penile implant.